Emer's office. So we just finished our RBM treatment and we got really nice and close around the lid, the under the eyes, the lids. So we're going to get a lot of improvement in fine lines. You can see now she's super red, her skin is feeling super hot, but it's going to go down and we'll basically start the soothing process. So you can see this color difference here between just how much redness or erythema is developing in the skin. What I'm doing now is applying topical PRP. So we use a number of serums and PRP to promote healing and hydration after this type of treatment. And what we're going to finish off with is a microneedling. So it's not going to be a very deep microneedling treatment. It's just going to be enough to make some tiny little holes in the skin and allow this to really sink in and be absorbed well by the superficial layers of the skin as well as slightly deeper. So that's what we're using right now, and I'm just really gently spreading it all over. After this, what we're going to do is apply a nice cold mask. We have some ice packs, and we'll start to bring the heat down. So one of the important parts of aftercare when it comes to a laser that's inducing heat or causing a thermogenic effect is that you want to take as much of that heat out of the skin as possible. And it's important because it really cuts down on downtime. Heat, increased circulation, that heightened blood flow is going to cause more swelling. So as soon as we are done and we can start to take it out of the skin, you're going to start really seeing an improvement in how the patient feels as well as how everything looks and what the swelling would look like.
So will she be using ice packs at home after the treatment?
I would love that, and I'm sure she would too.
Yep.
So the important things are just make sure that you're being really safe. You know, the smallest thing can cause an adverse effect. So when you are using an ice pack at home, you want to make sure it's wrapped up and that there's no skin to ice contact. You know, you want to protect your investment and protect the work that we've done, so you definitely want to have that protection on the skin. So now what I'm doing is applying hyaluronic acid, and I'm going to just work on kind of two parts of the face at once. Hyaluronic acid is naturally found in your body. It's our body's hydrator. And so what it does, I'll give you a little ice pack right now. What hyaluronic acid does is it cushions our joints, and we've basically been able to extract that and formulate it. Tell me if you're okay. We've been able to take that and use it as a very, very popular ingredient in our aesthetic practices. So topically, hyaluronic acid is great as hydration. It's a very thin product, but it works in a really neat scientific way by drawing water to the area where it's applied. So you don't need a super thick moisturizer. The serum in itself is hydrating, but then it actually triggers the response in your body to recruit more water cells to come and hydrate the area. So it's kind of doing all the work for you without giving you that thick, goopy, hydrated, dewy feeling. Some people don't want that. So it's great under makeup, and it's great as a post-procedure topical agent. The other way that we use hyaluronic acid commonly, as many of you know, is in our fillers. There's hyaluronic acid-based fillers, and again, the reason that fillers tend to swell up is because they recruit water. So you get that increased swelling, which settles down a little bit, but the lips stay nice and plump because of the hyaluronic acid. So it's a big ingredient that we use. What else do we do? So post-procedure wise, our patient already knows the drill and she's got all the products, but we incorporate a number of products because they're each going to give you their own benefit, and a lot of these products are absorbed in different ways or they work in different areas of the skin. So for example, after this procedure, what we're going to start incorporating will actually be a vitamin C serum, which is great for healing and also great for brightening on the skin. We'll incorporate some growth factor serums, which combine cytokines, growth factors, and essentially everything that your skin needs to repair the cells that we've essentially laced and are causing turnover with. So by adding in those healing agents, your skin will be recovering a lot quicker. There will also be hyaluronic acid in her regimen, some really great moisturizers. And once we've gone through this initial healing phase, which will probably be about 4 to 6 days, then we'll go back to her regimen, which incorporates use brighteners and coming in regularly for the maintenance type of resurfacing treatments that are very, very mild, Just a couple days of downtime with some light redness, mild pain, a little bit of light flakiness on the skin. Pretty low key.
Can you come in for an appointment for only microneedling with PRP?
Absolutely. So microneedling and PRP is one of our less downtime treatments, but it's still a great treatment to get a little hydration there. So microneedling and PRP is something that we do. Patients come in for it. It's quick. It gives you a lot of improvement. It's awesome for maintaining the reduced fine lines and shrinking your pores. It's just awesome for that glow that you want to have in your skin, especially in the summertime. You don't want any super aggressive lasers. She's awesome. She's out of the sun and using skincare products and sunscreens and hats. So you can do lasers in the summer, but to have something to just maintain nice, healthy, vibrant skin, microneedling and PRP is great. Any time of year, but definitely in the summer. And you can come in for that. Bring your hip to the right for me. So you can see that she's not bleeding. We're not doing a super deep microneedling treatment. If we were doing this alone, we would be adjusting the depth for different areas. There's a lot that goes into these treatments. So in different areas of the face, of course, there's different amounts of fat. The skin is at variable thickness. It's important to adjust what you're using for different areas. So one of those kind of part of what goes with that, we encourage our patients to use at-home micro rollers, which is like the at-home maintenance version of microneedling. The trick with that, you definitely want to be cautious in how you're using your micro roller. You can cause some little micro tears in the skin if you're doing it too quickly or in a less than ideal pattern. The other thing is that you want to make sure your micro roller is the correct depth. So your skin really in any given place is not any more than 3 millimeters, and your micro roller shouldn't necessarily be any deeper than 0.5. We have smaller micro rollers that are great for around the eyes. And you want to make sure that you're very gentle with your micro roller treatment. You want to make sure that you're not just going deep because you think it'll be better. It's not. When it comes to skin, less is more. You want to be gentle with it.
When you do microrolling at home, how often should you do it?
Once a week is ideal. And it can change. Go ahead and put your head back to the center. It can change for different patients depending on what your needs are, what your skin type is. But for the most part, just once a week is enough to tell your skin to start to turn over and kind of kick back into shape. And microrolling is really ideal for anyone as maintenance for fine line prevention. Someone who feels like they have larger pores or congestion in their skin, and definitely good for someone who has acne scarring. So that's a big one. Even just a small amount of needling, that micro trauma, that mechanical breaking down or breaking through the skin is going to really help to cause those scars to soften and cause the surface of the skin to look much smoother. We do really like microneedling there. So there's a lot of patients who are really good candidates for microrolling.
How long does the redness from the laser treatment last?
She will be the most red today, and it will start to minimize as the days go on, so each day will be a little bit less pink. She'll have probably some really fine shedding of the skin, like really light dryness and flaking. But all in all, it should only be about 4 or 6 days. So one of the great things about Erbium, the laser itself, it works by it targets water more so than like just ablating the skin. So it's not considered a painful laser, it's considered a cool laser, but it develops heat afterwards. So that's why she's feeling really hot at this point. And what's a very light downtime or a little bit more aggressive, almost comparable to CO2. So if someone comes in, you doing okay? Mm-hmm. If someone comes in and they say, well, I only have 3 days, but I want some resurfacing, you can do a light Erbium. Or if they have a week, you can go a little bit stronger. So it's really neat that you can adjust it. It's important to communicate what you want with, what you want with your provider. And That's how you choose what laser is best for your skin type, the downtime that you have, and what your expectations are.
So for those just tuning in,
Okay. Are you sensitive? All here, I'm trying another spot.
Because it is fractura too.
Are here super sensitive? Pretty sensitive. Okay, we'll skip that part, it's not necessary.
so for those just tuning in, can you just explain what the erbium laser does?
Yeah, so erbium laser uses laser energy that targets the resurfacing. So it's a non-ablative laser unless you choose the ablative. So it's a fractional, and what that means is that it's only targeting a fraction of the skin at a time. So you can make your treatment more aggressive or less aggressive depending on what your downtime is like and what your skin needs are. And you're looking at getting some light resurfacing or moderate or even more aggressive resurfacing depending on how we adjust it.
My eyes are nice and hot right now.
Your eyes are getting more swollen by the minute. They sure are. So I'm just applying a little bit more PRP. So erbium is that really great middle ground. It's not as necessarily, we consider it sort of not as aggressive as a CO2, significantly less downtime because you're not getting that scabbing part of your healing process. You'll just be red, hot, and then each day it'll get a little bit lighter and you'll have a little bit of light shedding. Not dramatic peeling. She will probably get a little bit of darkening of the skin around the eyes, but that's because the skin is much more sensitive in that area. And her downtime will be pretty manageable. And of course, she's going to follow her skincare protocol and the healing and using the mask, hydration, all of that to really get it through. The cool thing also about erbium is you could treat, I don't know if you can see it, but we treated right over her lips. So there's all these tiny little white specks, and these are the columns of energy that are going into the skin. So all of that's going to shed and exfoliate. The lips are important. Lips and eyes are very important to address. You can definitely develop lines on your lips. You can develop skin cancer on your lips. So having things that exfoliate that outer layer is really important. Keep everything nice and smooth. Keep the lines minimal. That's great.
Kim is asking if the microneedling is similar to a vampire facial.
It is. So I'm going to put PRP over your eyes, just keep it closed. So the vampire facial does use PRP and microneedling. But, you know, as a standalone treatment, the microneedling would be a little bit more aggressive than what we did here, for example. But it's a really good maintenance. And it's only the vampire treatment because we're drawing it from your blood. The way we get PRP, so the way we get our little golden serum here, we draw blood, centrifuge it, so we spin it very quickly until all the particles that are heavy sit to the bottom. The liquids all rise to the top, just like oil and water, and then we take that yellow serum and we use it for healing. So this concentrates about 90% of your growth factors, increases your healing by about 40%. Whew. All right, we're getting there. All right, we're just about done. I'm gonna grab some sheet mask and we'll be all done. She's feeling hot and toasty, so I'm gonna grab a fan. We're gonna ice her down a little bit, cool her skin, and that's it for our post-procedure. If you guys have questions, please let me know and I'll adjust them. Thanks for watching, guys. How do you feel?